¿Estás buscando un empleo o una nueva carrera profesional? Hispanic Achievers te invita a su próxima Feria de Empleos a llevarse a cabo el martes 25 de septiembre de 12 a 3:30 de la tarde en el Florida Hotel, conectado al Florida Mall en Orlando. Ven a conocer reclutadores de Florida Central. Avisa a tu familia y amigos sobre esta Feria de Empleos el 25 de septiembre. Para más información, llama al 321-277-0850 o visita hispanicachievers.org. Ahora puedes demostrar tu orgullo hispano mientras manejas en la carretera con la nueva tablilla o placa de auto hispana conmemorando los 500 años del descubrimiento de Florida por Juan Ponce de León.
Obtén tu tablilla hispana este año y harás la diferencia.
Solo 1,000 se necesitan para hacerla permanente.
Su donativo ayudará a estudiantes con becas.
Nuestra comunidad se beneficiará con más programas y servicios.
Resalta nuestra cultura, nuestras raíces.
Demostremos que en la unión está la fuerza.
Obtén tu tablilla hispana en el Departamento de Vehículos de Motor más cercano o llama hoy al 321-277-0850.
Hi, I'm Danny Ramos, and welcome to this week's edition of Hispanic Speak Out TV, brought to you every week on Bright House Cable, channel 49 at 9:30 p.m. We've been on the air for 9 years now with Bright House. I'm here with my co-host, Glenda Chauncey and Jose Miranda. But before we get started, I want to show you the Lawyer's Consumer Directory. The Lawyer's Consumer Directory is found in 170 7-Eleven stores. Before you hire a lawyer, get a copy of this booklet. It's free of charge in any 7-Eleven in Central Florida. It has a lot of information on a lot of subjects, including how to hire a lawyer. So pick it up. It's free of charge. Don't hire a lawyer until you get this book. Hi, Glenda. How are you?
I'm doing wonderful. How are you?
And Jose, how are you?
What's up, brother?
You made it. I saw the car was actually parked in between the white lines this week.
Was it?
Yeah. I always check it, you know. And
It
that's
wasn't my fault.
When it's parked a little bit off, you know, I know we got to be a little softer on you because I know that you've been, you know, hitting the souse a little bit or something.
Yeah.
Listen, I watched the Democratic convention, you know, and some exciting stuff is going on. This show is actually airing after the convention is over, but some of the highlights that I've caught, you know, Bill Clinton, you know, like always, he's done a great speech, but like you mentioned, he's got to go the party line. He had to go the party line in order to get her elected, his wife elected,
right.
Because if Obama is out, that means she's no longer Secretary of State, so she won't have a platform.
Right.
Okay. So, what do you think about what's been going on with the election, you guys, with the convention?
Well, I haven't really watched that much of the convention, although I did watch the Republican one.
Okay.
But not as much as the Democratic one. But, you know, I don't know. I think it's so much
Why did you
hype.
watch the Republican one and not the Democratic one? What's the matter?
She wanted to watch
Did
the
you
circus.
lean? Did you lean Republican?
No, because I will tell you, because there were some libertarians there that were speaking. We had Dr. Ron Paul and then, you know, Gary Johnson. So,
Okay.
But they didn't get up and
Gary
speak.
Johnson was speaking?
Well, no, not at the actual convention itself.
Oh, he was
they
speaking
were not
outside on the
welcome.
front- on the street?
You see, they weren't welcome. Exactly, but that's okay. You
Yeah.
got to start somewhere.
Yeah, well, that's
many
what-
people do start on the street.
Yeah, all these guys running for president did. I remember when Mitt Romney was coming to Seminole County, and he was just going to these small little meetings, you know. And now he's big time.
Well, you know what's interesting about Gary Johnson? I mean, I'm just going to interject here at the moment because I get on a lot of social networks and so the Facebook and all the other Twitters and all the other crazy things. Let me tell you, he's a smart man. He knows how to hit the market. He actually checks in wherever he's giving his speeches or he's going to go talk or whatever he checks himself in on Foursquare. I think that's pretty cool, actually.
Yeah.
I don't see many people doing that.
I think that, you know, right now.
He's like, on what? Foursquare. It's like you check yourself in to let people know where you're at and what you're doing. It's almost
So they
like
can follow
tagging
you.
so they can follow you. I mean, think about that. He's really hitting that
Well,
younger generation.
It's a great mechanism for terrorists, too.
Terrorists?
they know exactly where you are.
They can go get him. Oh, and by the way, it's funny you say terrorist because where he was today was speaking in front of the Muslim organization. It's funny you said terrorist.
Not assuming, you cannot assume that they're terrorists, okay? Let's not go down that route.
Oh, well,
because we get a lot of phone calls down at Bright House. I don't want to do that. But one of the interesting things in the convention, I found a couple of interesting things. First, the First Lady spoke, and the thing that struck me the most out of that speech was one sentence that she said, and I'm going to paraphrase it. She basically said that, how can we be happy families when there are families that are unhappy and that are in need? So she's setting, that's the platform for, okay, if you got something, you're supposed to give it to somebody who doesn't have it, or a percentage, or...
So does that mean all these designer dresses that, you know, she spends tons of money? Because I did hear, those things are not given to her. She does have to pay for these designer dresses that cost anywhere from $5,000 up to $10,000.
Yeah.
Why can't she go shop
Well,
at
you
Ross?
want to know something? We're doing a feeding of the poor. Our chaplaincy is doing a feeding of the poor. We do it once a month. Okay, and we're doing a huge feeding of poor people in downtown on Central Avenue for Thanksgiving. The entire event, including food, drinks, table rentals, staffing, cost less than $3,000. So she could have done a year's feeding of the poor for one dress.
Exactly, that's my point. What do they spend on these conventions?
No, tens of millions of dollars.
Yeah, but it's not that money's being raised through the donors and stuff.
Yeah, it comes out of donors and stuff. But if
it
you
comes
take,
out of someone who's willing to give up that cash.
So millions of dollars, super PACs,
but
the
that's
ones,
it,
the lobbyists.
Jose, you just hit it right on the head. Yeah. Someone who's willing to give up the cash. Now, if you're going towards a route where the government is going to use government funding to give to poor people, which I don't think is a tremendously bad idea. The only problem is that I would rather give to poor people my way, the way I want to give, to the group I want to give to. Now, you know that if it becomes a government program, which it has been, it's going to go to certain groups.
Of course.
And those groups are the groups that are more sensitive politically to the elected officials, the ones that they want to give to. I went through an elected process of lobbying for the license plate, and let me tell you something, it was horrific to try to get through there, because there are people that don't want you to go, and if they paid more or donated more, you're out. You're just out. Sure. You're out of the game. Yeah. So no matter what, the political process becomes corrupt, even in I want to help you concepts.
Yeah.
You know what I mean?
In the smallest forms.
That was a very interesting concept to me, where the First Lady would come out with a socialist statement, and when they're saying that the next 30 years, what happens now will determine America for the next 30 years.
Socialist statement?
Because it's not capitalism. Capitalism, you decide where your money goes.
Capitalism is just greed, man, okay? The more money you can make, the better you are.
No.
Okay, and what she was saying is that she was pointing out to the big spenders, okay, those $1 million guys, that you can afford to throw a couple of eggs down here.
Listen, Jose,
okay, that's what it is.
All the big guys together don't account for what they're spending. Okay, if you took all the rich people in this country and you piled them up, okay, they need to hit the middle class for this. They can't, you know, you're talking about 300 million people in the United States. Let's say 30% are below the poverty line. 100 million people. 80 million people. You know what kind of money you're talking about?
But this is a problem I have when you're talking, and both of you on your both sides politically. But what gets me crazy is I always refer back to the banks, because here you see, for example, Bank of America was given billions of dollars, by the way, of our taxpayer money. They have not helped one homeowner, not one.
Who?
Bank of America.
Really?
Really?
Okay.
Okay.
What are you talking about? Who?
And they make trillions. And they make trillions of dollars. Why aren't they extending help to these families?
Because
if this is really what their belief systems are, if this is what I'm hearing.
It is not their job. It's not their job. The government has taken over that responsibility. You see, there is a time, and I've been doing the philanthropy number and the diversity number all the way back to the early 80s, okay, through major corporations. There was a time that you go to a major corporation and they would do the philanthropy number, whether it be FedEx, Colgate-Palmolive, AT&T. They had philanthropy departments. They had their own foundations. Right. FedEx has its own foundation. So FedEx takes a huge amount of profit, gives it to its own foundation, and then the foundation decides who to give it to. Okay? Now, they give the money to nonprofit organizations, of course, that are sensitive or fall in line with their belief system. That's the decision-making process of independence of where you put your philanthropy. The government process is going to be where whoever that politician is friendly with.
Who's ever benefiting
Who's
from
ever
it.
benefiting
of course,
from that.
Of course.
And then what happens? When election time comes, they turn out the troops in the street. Because anybody who gets money from a government or anybody who gets money from a politician, they got to turn out the troops in election time.
Well, you know,
and I've been through that in New York.
You know what drives me insane, though? I mean, I'm driving down the road, not that I pay attention to too many political signs, but I see, you know, pro-life, and I can't remember the other thing, and it's like, why are we talking about abortion issues? Our country is in a financial crisis, and we're focusing on abortion.
Because that's a way to avoid the financial crisis. By the way, when they opened up the Democratic Convention on the second day, okay, a Methodist minister who was a governor, okay, stood up on the floor and called for a dropping of the rules of the convention, which means they're not going to follow the procedure. And he actually called for a quorum vote for two things. Number one, to include the word God in the convention, which was completely dropped from the convention. Okay, in the past 12 years, and I heard this on CNN, which is sensitive to the democratic process. The word God was mentioned, I think, 18 times in 12 years ago. It was mentioned 9 times, and then last time around 4 times. And now it was completely dropped from all of the speeches. Okay, this guy, this Methodist, got up there and he said, "I want to drop the rules of the convention for a vote." And they had a vote on whether to include God in the convention, the word God, which had been dropped from the speeches. And he, as a Methodist, as a minister, wanted that, and he was a delegate, a major delegate. And number two, was that the convention adopt Jerusalem as the capital of Israel officially, which was not. Okay? And when they did the vote, the guy from San Antonio, the mayor of San Antonio, had a call for a vote 3 times. Now, the vote is done by loudness. Everybody in favor say aye, you know? So they did that, and what happened was they couldn't distinguish between the yeses and the noes. So they had to go to the 4th time. And then, as far as I was concerned, it sounded pretty equal to me.
Yeah.
But he threw it and said 2/3 of the majority vote yes on the amendment.
But how oxymoron is that? Because here you want to say God in speeches, but we can't even say the Pledge of Allegiance in a lot of our schools. So and using the word God.
You don't want to offend people. They try
offend who?
For example, atheist kids or parents have sued the various boards of education.
Well, they don't have to say God.
They can substitute their own. Listen, if you're an American...
All I'm just saying is that they're trying to do this. The same thing with the Arab thing. I mean, the Israel-Arab thing.
But you see,
we have a situation there that if we don't keep the lid on it in some fashion, it will explode and include us in it. That's another way of appeasing both sides of the fence.
But you can
I'm not saying it's right.
No.
I'm not saying it's right.
So you're saying
this is what
I have to appease some atheist or some Muslim, and I am forced not to pray or not to believe or not to mention the word God in order to appease them and their belief, but they can't appease me and my belief.
But there's more words in the Pledge of Allegiance. I mean, it's saying that you are an American, and you know, if you don't want to be in that position, then don't be it.
The country was founded on the premise of God. Every founding father, was religious, believed in God, and they included it in all their speeches, in the money, in all the buildings that they built. This was a fundamental, and we're getting away from that. Now the question is, does that hurt the country?
Including slavery and the whipping, as they say.
Yeah, well, you want to know something? There's a lot of bad things that happen with religion,
and the incense and everything else. But it's perfectly fine.
But they don't do that anymore, right?
Okay.
So since they don't do it officially anymore, now they're officially telling me that I can't use God in the way I want to use it. Come on, you know, this is like, this is no longer America.
Yeah.
You know, what we have is a bunch of groups jockeying for power to try to influence and take over the thought process.
Line is power. Speaking about power, you heard that young man from I think Los Angeles, the mayor, up and coming Latino. I forget his name right now. He was very Julian. And he was very well spoken, and very proud of the fact that he stepped up there, a la, Mr. Obama when he did it on the Democratic Convention before he became president. You know what I'm saying? So I think it's very good.
We're not talking about, you know, talented people. Well, the next 30 years will be determined by this election, but I still don't know who I'm going to go for. I like the idea of helping people, but I want to determine who I want to help. Well, I don't want the government to go into my pocket and take my money. We'll be right back with Josephine Mercado, who will talk about the Affordable Health Care Act.
And welcome back to Hispanic Speak Out TV with Bright House. And this evening we have Ms. Josephine Mercado from the Hispanic Health Initiatives, basically dealing with the insurance that's being offered, advocate or?
Well, basically our organization really focuses on healthcare, and healthcare reform is a big issue here in the United States. So we were forced into kind of advocating for the Affordable Care Act.
Okay, very good. And being that it is relatively new, I'm assuming you said, what, a couple of years that this has been passed?
Yes, March 23rd, actually, 2010, President Obama signed this legislation into law, providing a series of free and low-cost health services for especially those people that are low income or uninsured. Primarily, it deals with patient protection. The name of the law is Patient Protection and Affordable Care Act. And as a result of the law, many abuses that have been going on in the health system have been put at an end, or will be put at an end in some time in the near future.
Okay, very good. And basically you're dealing with families, you mentioned sometimes low-income families, that can't afford the health insurance, or they don't probably have it through their employer?
The majority of the people that we help are uninsured, are also people that qualify for all sorts of health services that they are totally unaware exist. And now with the Affordable Care Act, there's even more opportunities for them to get access to health care.
Okay, very good. And I'm going to assume, is this something they go through by they make, or is there any qualifications? Is there something that goes along with that?
There will be many restrictions on who will qualify. For instance, income is going to be an issue as to who will get what kind of help through the new health care reform law. It is expected, I don't know if you're aware of this, but there's over 52 million Americans that are uninsured, and 32 million of them stand to have access to health insurance through this act.
Well, I mean, many small businesses, I don't, if I'm wrong in saying this, but it's very difficult for them to also carry insurance, I think, for their employees.
That has been a very serious problem for the small business owner, especially because prior to this law, many of the small business owners were paying higher premiums than the larger corporations. Well, this law is going to put an end to that. Not only are they going to put an end to that abuse, but also the law will provide tax credits so that now, for the first time, these small businesses will have help in paying those high insurance premiums that they were paying before. The high insurance premiums, that also is going to be curtailed. It's not going to be very easy for insurance companies to just go ahead with any high premium that increase that they want to put through. Anything above 10% has to be authorized or approved through a system that the healthcare reform law is putting in place.
Well, anytime I hear like systems, government kind of craziness there, and I always think red tape. I think there's a lot of things out there. Some people may are getting some misinformation on, you know, how to get this, what's wrong with the system, especially election time when there's a lot of, you know, negative campaign ads out there talking about the Obamacare and all these things. I mean, what do you see happening with the misinformation?
Well, to me, it's outrageous, some of the statements that are coming through insofar as how terrible the law is. Quite frankly, those that have been studying the law, and these are non-biased, consumer-oriented groups, will tell you that the law is the best thing that we have on hand at the moment. Those in opposition have failed to present a plan of action that will benefit the community the way this law will benefit our community. We have, for a long, long time, allowed the insurance companies to have denials for pre-existing conditions. We have had lifetime caps allowed for a long time. That will be brought to an end. In the area of Medicare, we're going to have, finally, by 2020, there will be an end to that donut hole issue that has been around. That has been, especially for people that are very seniors, that are very, very sick, and have to take 3, 4, 9 types of prescriptions. They go into that donut hole almost.
Well, I mean, but let's face it. I mean, honestly, I mean, looking on the other side of, you know, pharmaceutical companies, the doctors, hospitals. I mean, it's a little all not balanced very well. I mean, you get a bottle of pills that cost, you know, these elderly, you know, patients that you want them to spend $50, $60, $70 for, you know, one bottle. I mean, there's something that's got to be more of a balance. It's all about the money and these corporations and these companies.
That's precisely what this law is trying to do, and it will do it. And with time, people will begin to see it. Right now, here in Florida, there are a number of people, there are millions of people that are benefiting from the law already. Unfortunately, a lot of us don't know it unless we are their relative or their friend or neighbor, and they happen to tell us, oh, I just got that free colonoscopy through the Affordable Care Act, which was something that they probably had to pay something out of their pocket in the past. Now, they don't have to, not through the law.
So what if a family's out there that does not have insurance, what would you recommend? Where do they go to fill out an application to see if they meet the qualifications of this program?
Actually, there are no applications or qualifications at the moment. Come 2014, that's when the real big changes are going to come in, and those applications that you're speaking about will come into play.
So no online access, no information like that?
At the moment, unfortunately, Florida has decided not to implement the law, so there is really no online access here in Florida.
Well, that just sounds a little crazy. I mean, that doesn't make a whole lot of sense. I mean, if you're offering something for 2 years and people don't even know where to go to get this help, you know, that just doesn't make sense to me. I'm trying to understand.
Well, I cannot explain it to you other than that people need to be more informed about who is in these elected offices, and they need to know more about where they stand insofar as the services that we need.
So it's kind of in a bickering stage, going back and forth, and
absolutely,
so you can get that ironed out.
The state of Florida, along with a number of other states, decided instead of implementing the law, they decided that they were going to wait until the Supreme Court decision would come through, which, by the way, Florida was one of the leading states in that lawsuit. The Supreme Court decision came through at the end of June, and it was found that the law is constitutional and it can be and should be implemented. Florida has once again decided to wait until the November election, and depending on the outcome of the election, that will determine what they're going to do.
Republican, Democrat,
that's precisely,
debate back and forth.
Precisely, and it's unfair because there's a lot of people, millions of people here in Florida that stand to benefit. In the area of Medicaid alone, 1.6 million Floridians will qualify for Medicaid under that new law. These are some adults that have not had any kind of health insurance since they were 19 because they came off kid care or whatever the children's coverage was, and they had no access to health care insurance, not through their employment or not out of their own pocket because it was too expensive.
So unless they're doing their own research or meeting an advocate like yourself who's out there trying to educate the public and let them know what their rights are, I mean, they're pretty much just out there. I mean,
well, they can also go into healthcare.gov and they can input their own personal information, including the state, and that will make them, they can ask questions, and that will make them more aware of what is available here. We do have, for instance, a plan for people with pre-existing conditions. There is a health insurance plan. In fact, we have one of our volunteers was able to get coverage finally because he had type 2 diabetes. No one would insure him. And now he has coverage through this plan. Regrettably, this plan is only good until 2014. If for any reason that law is no longer in place by 2014, he will lose that plan.
So right now it says here, I just noticed where a family of 4 making up to $88,000 a year. That is a qualifier that
they would qualify probably for some of the tax breaks. That doesn't mean that they would qualify for Medicaid, but they would qualify for some kind of help, a tax credit of some sort.
So at that point, then there's a monthly payment. Is there something that they would pay?
It's my understanding that there will be monthly payments, or there will be annual payments for sure. In all likelihood, it will be monthly because otherwise it would be too much. As to the exact amounts, there's a number of variables that come into play, so you do not know the exact amount of what kind of premiums they will be paying.
Okay. Well, if they're, to the audience, if you wanted to instruct them or try to help them, since you are an advocate, what would be the steps and just little small steps that they could take to...
I think the first big step is to really pay attention to what the candidates are speaking about. Pay attention to what is in the law. We know that there's a lot of misstatements, misinformation that's out there, and you as a consumer need to be better informed. So you need to find out for yourself what is really going on and how this law is going to affect you. And they can do that by going on healthcare.gov.
Okay. And what if they wanted to actually reach out to you? What would be?
Well, they certainly can call our office.
Okay.
We do have an advocacy group. We have been going to churches and other civic organizations, explaining to them what the law is all about, showing them information, written information on the law, written by AARP and other independent groups that are really there talking about and for the consumers and not about politics or politicians.
Okay, so, the fun stuff.
It's really sad that...
If you'd like to give them your contact information directly, that way they can contact you.
Our telephone number is 407-339-2001.
Okay, and you're located in Castleberry?
We're located in Castleberry, but Castleberry is really our headquarters. Our work is actually in the community. We go to churches and other community events where we do spread out this information. We also focus on health education.
Okay, very good. Well, thank you so much for coming this evening.
Thank you for
appreciate
inviting
it.
me.
All right, very good. Thank you for visiting us tonight, and we'll see you next week on Hispanic Speak Out TV with Bright House. Have a good evening.
¿Estás buscando un empleo o una nueva carrera profesional? Hispanic Achievers te invita a su próxima Feria de Empleos a llevarse a cabo el martes 25 de septiembre de 12 a 3:30 de la tarde en el Florida Hotel, conectado al Florida Mall en Orlando. Ven a conocer reclutadores de Florida Central. Avisa a tu familia y amigos sobre esta Feria de Empleos el 25 de septiembre. Para más información, llama al 321-277-0850 o visita hispanicachievers.org. Ahora puedes demostrar tu orgullo hispano mientras manejas en la carretera con la nueva tablilla o placa de auto hispana conmemorando los 500 años del descubrimiento de Florida por Juan Ponce de León.
Obtén tu tablilla hispana este año y harás la diferencia.
Solo 1000 se necesitan para hacerla permanente.
Su donativo ayudará a estudiantes con becas.
Nuestra comunidad se beneficiará con más programas y servicios.
Resalta nuestra cultura, nuestras raíces.
Demostremos que la unión está a la fuerza.
Obtén tu tablilla hispana en el departamento de vehículos de motor más cercano o llama hoy al 321-277-0850.